Over the last few months, using weight loss drugs has become a big topic. Many people are saying it's positive, whilst others are saying it's negative, as well as those saying maybe it's positive but it has side effects, um, as well as people saying you can use stuff like exercise and diet and nutrition and other things to help yourself rather than relying on a drug. And of course, some people maybe they will need something like this. But I'd say before I read the article, I would say for 99% of the people, it's not exact statistics, but I guess they wouldn't need such a drug. And even then, for the last, let's say, 50 to 100 years, how have people managed it? Maybe people are highlighting it more now because what we're seeing, and maybe it's also linked to people having jobs that are in the office and not being able to go outside as much, as well as ultra processed food and other things, which is why maybe people are thinking we need weight loss drugs. But if you remove certain things, maybe you won't need these type of drugs to help people, particularly as maybe it has side effects, but also people once they've lost the weight and they haven't formed any habits to help continuing it because they've just relied on a drug. And we're reading from BBC News article online. GPs to get £3,000 bonus to maximise weight loss drug prescriptions. GP practices in England are to be paid an average of £3,000 a year in bonuses to prescribe patients weight loss drugs. The government is adding the incentive payment to the GP contract starting in April. GPs will also get extra money worth about £1,000 a year for referring patients on to weight loss programs. Before I read any more, that's what they should be doing, rather than targeting getting people on these drugs. Target on other things which are, I'd say, more common, has been done for a long time with a lot of success, and is something that doesn't necessarily have side effects and doesn't really cost much to the NHS or to the taxpayer as much as certain drugs do. Minister said it was important that patients who could benefit from weight loss support were able to access it, but obesity experts warned that the scheme would have limited impact because the drugs were still being tightly restricted on the NHS, and this move would do nothing to widen eligibility. The incentive payments would only apply to Mounjaro. The drug started being available on the NHS in 2025, but not all GPs are yet prescribing it as often as expected. You can read the rest of the article online on the BBC News website. But what I've said before and what I'll repeat now is people should use these things as a last resort. And I don't understand why they're trying to specifically target a certain number to increase people not getting on these prescriptions. Like, let's say you have a target of getting 100 people on this prescription per year, but all the patients that you see, maybe 3 people are eligible. So why should anybody have the pressure of these targets, particularly when most people will not need these drugs? And with the target, it seems like you're pressuring people into almost forcing people onto these drugs, as well as with the payments and other things. Maybe some people will be prescribed these drugs when they don't necessarily need it because people are being pressured to meet targets to get extra money for their GP or whatever. So I feel like should be looked into more before it goes live in April.